Fantastic century by Amol. It is, and after seeing the full hall, I'm really happy that whatever efforts which we had taken yesterday's travel, we came here at 2:30 in the night. Duplicate होता है का? एक सगळ्यांना रिक्वेस्ट आहे, मी अख्खं प्रेझेंटेशन तुम्हाला देऊन टाकणार आहे, त्यामुळे फोटो काढू नका. I can give you the whole presentation. Thanks for your kind introduction, and I'm really happy to share what I have done for last 50 years. I appreciate the vision of organizers. When they called me about to talk on this subject, I really came to know that they are looking something further. Artificial intelligence should not be called as an artificial intelligence. It is an augmented intelligence. It is assistive intelligence. It is uplifting intelligence. You are all very naturally intelligent people. It is going to help you. And see what the type of galaxy of people we had. We had Sunil, we had GSK sir. I was an intern with him in 1979. He recalled it very vividly. And the yesterday's performance, I have been watching for them for years together. Friends, all the great महफिल्स भैरवी नेहमी सवाईची भीमसेनच करतात. This is my disclaimer. I am not an expert. मी इंजिनियर नाही आहे. IITला मिळालं असतं, अच्युत गोडबोले मला सारखं म्हणायचं IITला आला असतं तर बरं झालं असतं म्हणून. I am not a coder. I don't have a degree in AI. There are a lot of degrees which are coming. But what I do, I practice 3 P's. Procure, म्हणजे चोऱ्या करून आणतो बऱ्याच वेळेला. I know how to extract the things without paying money. Practice and preach what I am doing right now about digital technology and artificial intelligence. Friends, all great medical innovations are ridiculed right from the incubator to ICU to the theory of circadian rhythm. Same thing happened with me. When I used to talk about AI, digital technology, 15 years back, 20 years back, there was only one answer. काम से गया, पागल है. My last sentence used to be, a time is going to come when you are going to forget fill up currency. You are not going to count money. This is what has happened today. So friends, I am not an exception, but what I do, I practice art of giving. I am very happy to see all my batchmates here. We are all 50 years together now. And at the age of 70, I want to give everything what I know. And I am very happy that I have got the next second and third generation also in the audience. I got a lot of disclosures. What are the disclosures? These are all my friends. They are all my friends point API, RSSDI. They have been encouraging every time for me to do something more about. And we have got a group called as Doctors AI. This scan will come at the end, like what Amol did. You have to scan the code and you will become the member. Do I have any conflicts of interest? No. Nobody has paid me anything to talk about manufacturers, equipments. Whatever I have done, I have purchased with my own, evaluated, criticized. I have not used AI in preparing these slides, except for 1 or 2. But it is your cheering up, encouragement, support for your unconventional things. So friends, let us go to a downhill task from 1974 to 2024. Half of my class is here around, and this is my PG students from MGM Medical College, and I bring you greetings from this place. Next time when you are going to land on this airport in Navi Mumbai. Very simple outline of presentation. I am going to tell you something about history. What is artificial intelligence and digital medical technology? How you can use in practice. What are the components of it? What are the types of it? What are the concerns about it? And what is going to be the future? Is it that much unexpected? Is it just a science fiction? No. 1956. Name of the person, John McCarthy. What he thought, that there may be something which will think like human being. Think about it, decision he will take, and he will be reinforced. That learning will be reinforced. And that was the exact thing, and it had a concept called as a big data. So it was augmented, assistive, affirmative, add-on or accelerated intelligence, whatever you want to say. Go to 1997. This was a news everywhere that a machine defeats a two-time world champion, Garry Kasparov. And name of the machine, Deep Blue. Friends, we are in a stream of evolution. What is our stream of evolution? Go back 1765, mechanization. 1870, mass production. Conveyor belt came. 1969, automated production. And today, we are in the world of technology and ChatGPT. Is it a rocket science? Not at all. AI is there everywhere. AI there is in your pocket. You start typing, it will be predictive typing. Whatever the word you use maximum, that will be typed again. So it has got three components. The first thing is called as a deep learning. Second is called as machine learning. All these things together gets artificial intelligence, but the fuel is data. The currency of artificial intelligence is data. If you don't have good data, that is called as a structured data. Structured data and unstructured data. Whatever prescription you write with hand is a unstructured data. Whatever prescription you write on the EHR is got a structured data. It is not at all a rocket science. On the contrary, I consider this is like a discovery that it brings back the things together with you. What are the advantages? Many. Speed, cost, availability, versatility, multimodal inputs. What is multimodal? Text, video, audio. You are sitting in your consulting, the patient is telling you a story. History you are asking. Not lifting any pen. All your 5 minutes history can be narrated by an AI application. And it will be there in front of your screen. It is easily possible. So accuracy, explainability, and most is robustness. It is a blanket. So what is rule-based logic to the risk scores. You have got, everybody has got a mobile phone. Take down an app called as a calculate by QX. You can calculate EGFR, everything together. Then there are predictive models. Today Tejas was talking about LPA, lipoprotein A, apolipoprotein A. So if your LPA is high, whatever may be your cholesterol levels, either you must exercise very regularly or you should take statins. That is from the predictive models. Then there are targeted neural nets. Tanvi is here, she is one of the digital pathologists. She can see the oncopathology slides from all over the world in her clinic, in her place, in her home. That is because of digital pathology. And then comes the boss of everything, that is called as a ChatGPT. What is ChatGPT? It is generative AI. And it is called as a large language model. Don't get confused with all these words. You must know how to drive the car. You don't know where is the carburetor and what fuel it was. What are the advantages? Accuracy, big volume, consistency, it saves time, trouble, torture of travel, and most important, no medicine in the world. It will increase your serum levels of confidence, concentration, competence, enthusiasm. You will be enthusiastic all the time because like what Amol said, that there is always so many new things are coming, you are always enthusiastic to learn. And it makes you acceptable, adaptable, humble, a new learner from every time, and best is to learn from juniors. Learn from your children, learn from your grandchildren. These are all the positive effects: availability of 24/7, accuracy, efficiency enhancer, future readiness, and it can reduce lot of safety and other risks. This is a pyramid. Everybody knows. What do you mean by wisdom? You have got raw data. When that data is processed, it becomes information. When it is further processed, it becomes knowledge. And further processed, it becomes wisdom. And on the top of it, you have got something called as experience. So if I want to go for a cataract surgery, I will go to the best experienced ophthalmic surgeon from that place. Because not only he has got data, information, knowledge, wisdom, he knows where not to cut. This is a very beautiful concept. I have never thought it before. Do you know what is a medical literature doubling time? In 1950, it was 50 years. In 2020, it is 73 days. I don't know what is today. The rate with which the medical literature is doubling. And what happens to any new technology in reality? There is a technology trigger, peak of inflated expectation, then there is a trough of disillusionment, there is a slope of enlightenment, and there is a plateau. Sunil was talking about this. But what has happened here, on the top is generative AI, and that is our ChatGPT. Our smartphone has replaced more than 40 equipments what we use day to day. सगळ्यांचे फोटो आहेत, बहुतेक आपला मेंदू पण त्याच्यात जाऊन बसेल असं वाटायला लागलं आहे, इफ यू यूज इट इन अ व्हेरी व्हेरी पॉझिटिव्ह वे. So let us, I told you about all theory, history, let us go for practical examples. From something very, very simple, something to complex. What is ChatGPT has got 180 million users. In just 5 days, it crossed 1 million marker. Netflixला त्यासाठी 3 वर्ष लागली. And 600 million visits per day. All this component of our day-to-day life, it is done by ChatGPT just at a click of a button. The latest model which costs something to you is called as a 4O or Omni. It represents a potential advancement. It does not have a language barrier. English, non-English, झुलूमध्ये बोला, हिंदीमध्ये बोला, राजस्थानीमध्ये बोला, तुम्हाला सगळं. एक सारा नावाची चॅटबॉट आहे, SARAH बाय WHO. WHO वेबसाईटवर जा, टाईप सारा अँड यू आस्क हर एनी क्वेश्चन. ते ॲडिनो व्हायरस होतं वगैरे सगळं फटाफट सांगेल तो. दीज आर द प्रॅक्टिकल चॅटबॉट्स. अँड व्हॉट हॅज डन, दे हॅव ब्रोकन द बॅरियर्स ऑफ डिस्टन्स. हायरार्की, कसला प्रोफेसर आणि कसला स्टुडंट, नथिंग. ऑल द नॉलेज अवेलेबल टू एव्हरीबडी. सिनियरिटी, लँग्वेज, हाऊ टू go to Google, type OpenAI and register with your Gmail. There is a difference between ChatGPT 4 and 4o because it is a multimodal and most important, it is in real time. If I got a glucose monitor here, it will show to my wife who is sitting in Nagpur attending her conference that whether my sugars are high or low. And you can see that it can be audio, video as well as text. So this is the screen which will appear when you type on this. So you message ChatGPT. So what you message ChatGPT, there are a lot of advantages of it. Example can be anything, right from quantum computer to whatever. What are the capabilities? Remembers, allows, is it trained? There are some limitations. We'll talk about it. Now I give 2 samples of communication. I can show it also live, but let me finish the presentation first. So I asked him to write a letter to Dr. Deepak Joshi, President so and so, for inviting me. And I communicate to Dr. Kulkarni, who is an ophthalmologist, about evaluating a very difficult ophthalmic case and restoring vision to near normal. Wish him all the best and future in attending is the best of eye care. So this is the answer which I got from ChatGPT without typing anything. It is the complete answer. I can show you this. I limited for 100 words. This is letter to Deepak Joshi. This is a letter of encouragement to Ashay Kulkarni. So these are possible. So what you do, start using it, you will be definitely. Now I have got a complex lab report. Everything horrible. BMI 28, diabetic so many years. I asked him analyze the report, explain about hypoglycemia and whether SGLT2 inhibitors are a drug of choice. It first analyze the thing. What is low, what is high, whatever the things are there. Mild reduction in kidney factor, kidney functions, LDL cholesterol, triglycerides, all this high. So it will tell me what I am supposed to do. Now forget about patients. One of the most important thing of any smartphone or AI equipment is the visual equipment. That is called as the pattern recognition. मी काय करतो सकाळी MJ मेडिकलमध्ये तो माझा अंगठा लावतो. अंगठा लावला की ते नॅशनल मेडिकल काउन्सिलमध्ये कळतं की SP कुलकर्णी सकाळी 9:30च्या आत नोकरीला आलेलं, त्या दिवसाचा पगार त्याला द्यावा. सो MRI काय करतं, CT स्कॅन, तुम्ही कोविडमध्ये CT स्कॅन केला, CT स्कॅन टाईम 10 PM, रिपोर्टिंग टाईम 10:02. 2 मिनिटात कसा आला रिपोर्ट? दिस इज कॉल्ड ॲज अ पॅटर्न रिकग्निशन. अँड these are the different kind of things which are going to help you in a bigger, better way. ChatGPT can help in patients counseling also. This was one study in which there were 5 C's were involved: cancer patients, caregivers, computer scientists, and clinicians. So they can, with the help of literature, they can tell what is going to be the best alternative. Rare complex diseases, so many rare diseases can be diagnosed. It is called as your proper input. That prompt engineering has to be perfect. This is one of the example. There was one child, it was during the height of COVID-19, a 4-year boy, he had discomfort when he was chewing, toothache, dentist negative, growth was slowed, occasional bed weights, unusual behavior, biting the objects, numb legs. सगळ्यात महत्त्वाचं म्हणजे पायाला क्रॉस करून बसता येत नाही. सगळी बाकी वर्गातली मुलं पाय क्रॉस करून बसतात, त्याच पोराला बसता येत नाही. ChatGPT was used when 17 doctors were concerned and it gave a diagnosis of tethered cord syndrome. Neurosurgeon relieved it, child is absolutely happy. Same thing can happen condition like diastomatomyelia, which we never think about it, but the AI thinks about it. There are certain ways that you should or should not use ChatGPT. Now, let us come back to our OPD. So you have got such a big OPD, 100 people are sitting. Can you recognize a person who is holding a gun in his pocket or having a hockey stick in his hand and तो तुमच्याशी हॉकी खेळायला आला नाही, कन्सल्टिंग म्हणून तोडायलाच आलेला आहे. So this is always possible with when you think out of the box. And this is a software of facial recognition of people. कुणाला उत्साह आहे, कोण कंटाळलेला आहे, कोण जांभ्या देते, सगळं कळते त्याच्यातलं. So this is in high security area, it will be really useful, and this can detect even emotions like violence. And this is an article which has told that how a human face differs at different times. It is a continuous online body language analysis, and it is with alarms. It will tell that there is going to be some problem. Now from image analysis come down to a chatbot. I got chest pain Saturday night 11:30. I asked, what are the question? चेस्ट पेन हो रहा है, कुठे होत आहे? लेफ्ट साईडला होत आहे. हात रेडिएशन आहे का, वॉमिटिंग का नाही आहे, अनलाइकली टू बी मायोकार्डियल इन्फार्क्शन, go to your general practitioner. These are the way in which chatbots behave. ChatGPT can help you in analyzing ECG. Take any ECG, any lab report with you, keep as a file in File Explorer. तेथे पिन मिळते त्या ह्याच्यामध्ये ChatGPTच्या ह्याच्यावर, त्याच्यात क्लिक करायचं, डाउनलोड करा, यू विल गेट ऑल द रिपोर्ट. दिस इज युअर होमवर्क. बट डज ECG ओनली टेल अबाउट हार्ट? नथिंग. देर आर ह्यूज गोइंग टू बी चेंजेस. This is called as a AI-enabled ECG. It tells the age and sex, ejection fraction, anemia, predicts atrial fibrillation, diabetic status, hyperthyroidism, renal disease, or even some very dreadful condition called as a peripartum cardiomyopathy. This is possible with simple ECG. Thank this man. He could look through all of us. And the radiology department has been converted into a smartphone now. But if I ask you, can you suspect diabetes from a chest X-ray? Yes, it is possible. The way in which the fat deposition of your neck is there, and this is the reference. Suppose there is a small nodule, suspicious nodule. Whether it is malignant or not, that can be answered by AI. And these are the standard references which can be accessed with the DOI. Now I got a patient, very funny, a gynecologist by profession. Only complaint was when she turns on left side, she gets a pain in the gluteal area. Otherwise nothing. X-ray, everything was normal. Actually she had a subtrochanteric bursitis, which is otherwise never thought of, but somebody has got an impacted fracture. This X-ray, if it is showed, it will show that there is a narrow disc space, either it can be osteophytes or it can be impacted fracture. Eye is supposed to be the window of our body. You can diagnose so many rare diseases, cardiovascular risk, with the help of AI and a branch called as the oculomics. These are the various references which can there are 385 notified diseases which can be diagnosed by AI fundoscopy. It is a very, very good application. It can even predict you when you are going to have Alzheimer's. This is about development of congestive cardiac failure from your fundoscopic things. Digital pathology, digital microbiology, recognition of the future antibiotics very easily possible. It has been said that from 50,000 chemical, there comes only one drug. So now with AI-enabled chemistry, it is possible. The pathology can be beyond H&E stain. It can tell you driver mutations, malignant versus benign, site of origin. So many times we come across people with cannonballs. We don't know what is the primary, but it will be helpful to you, and it can tell you prognosis also. A virtual autopsy also is possible with the AI and the different type of imaging technique. This is a very simple bedside test. I got an insulin chart, I got a sugar values, I know what the patient has eaten, what are the carbohydrate contents. So it calculates my insulin dose and it tells you how much of insulin is required. This is something absolutely funny. This is called as the augmented endoscopy, AI augmented endoscopy. Endoscope was put and there is something funny. The patient is very restless. Almost patient la premonition hota na ta doctor माझं काय खरं नाही मी मारणार. Like that. A case of chronic acid peptic disease company of back pain. Nobody was in a position to diagnose this. So we asked AI, explain the object appearing on the left side of the screen. This is normal, this is stomach. But what was the other thing? The object resembles an artery wall situated close to proximity to the duodenum. Given the size and location, it is most likely to be aorta and a very deadly and dreadful condition called as aortoduodenal fistula. If you don't treat it, the patient is gone in front of your own eyes. So this is the power of AI. Now, there are very, very simple things. Can I fractionate a PPT? Somebody has given me a PowerPoint. Can I take text alag, picture alag? Yes, it is possible. This is the website. Give me a video, I will make a PowerPoint for you. Or you have got something in your mind, you tell me, I will make a PowerPoint for you. This is one app which everybody should have. This is called a Gamma.app. It is creation of professional quality presentation, documents, web pages and website. If there is time, I can show you how it works. It is a bit costly. But friends, make a group and invest money on this kind of things. Because if you do a free version, they will be made by Gamma. Here, if you pay, आणि हे सगळे हुशार माणसं आहेत, तुम्हाला दाखवता ₹280, पण खालची लाईन वाचली का? It is billed annually. So if you want to want to use once, you have to be billed for 1 year. Now, okay, we have done everything. You want to publish some article. So what is your research question, whatever you have got one research question in mind, the first lecture, what is the incidence of coronary artery disease in COVID vaccination? So this is an app called as the LIT map. It is a unique AI tool for papers. So what it has done, from 1978 to 2022, it has given me all the papers. I have to just click on the paper link and it gives me what are the different kind of papers. This is one thing which is free. Register for it, illicit. You give the research question, it will search the papers, top 4 काढून देतात, तुम्ही कट पेस्ट करा, तुमचा पेपर त्याच्यामध्ये तयार होतो सगळ्यात. And it even takes out your bibliography, the high accuracy mode, and if you pay, you get a better service. Medical education is going to be a big change after large language models. We have talked of simulators and the anatomy table where there is no foul-smelling dead body, but you can learn everything. Have you seen any time lymphatics in a cadaver? Not possible, because lymphatics you cannot see in cadaver. I am going to the last part of my presentation. This is the way in which our life is going to change. Everybody has got a smart watch now. Now your smart watches are going to be converted into smart rings. These smart rings, they monitor everything. Your sleep, your SpO2, how many steps you have walked. or there can be better Indian counterparts where you can attach even a glucometer also. You must have heard of CGMS, a small patch on your shoulder, and it gives you all the activity, whether you run, swim, gives you glucose. But we are waiting for something like this. A patient of chronic renal failure, a type 1 diabetic patient. I will have something called as a smart skin. A patch which is applied on your mobile, you get the values and you get the ups and downs of the things. The future cloths are going to be different. So these are the smart sensors. They are going to process the data. They are going to be something called as actuators. They are going to store the information. They are going to communicate. You know what is the biggest problem of geriatrics? It is not any disease. It is fall. Once a senior person falls, he invites four different type of complications, and last is pulmonary embolism. So even fall detection also is possible with the type of clothes which you are going to wear. The future hospital gown may be like this. This gown will be connected with different kind of sensors, and you will get all the data here. This is the world of wearable health monitors, right from EEG to the plantar pressure. The plantar pressure is the main determinant for development or non-development of diabetic foot. And be ready to see such kind of things in and around you. This is called as a Google Lens. My friend Sagar is sitting in Navi Mumbai. He is wearing a Google Lens. He is connected with me on internet. He can see all of you. He can see this presentation also. After some time, the conferences like this are going to be absolutely obsolete. This looks like a pendant, but this is not a pendant. This is a fall detector. It can tell my senior patient that he's one fallen down, or even he gets lost. He's just on the backside of his home, but he doesn't know where is his home. This looks like a good banyan, but this is a Holter monitor. Friends, future can be totally unimaginable. Neuralink, you must have heard it, otherwise just follow this person. This is a implantable cardiac things. There is not going to be word called as a plagia. No monoplasia, no paraplegia, no hemiplegia, no quadriplegia. You will be connected with the transmitter in your brain, and your thought process will tell you that I should go there and have a cup of coffee. These are the experiments which are going on, and they are available. Exoskeleton, the name of this instrument is called as exoskeleton, and it has been used in India in the army section of it. And this Neuralink is going to be one of the very big part of it. So friends, whenever you have got any technology, any application, please use peripheral device wisely and sensibly. You can create huge amount of data. You can be fit and healthy. आपण लय भारी आहे सगळे. आपण इंडियन लोक आहेत ना, एकदम भारी इंडियन जुगाड. कुठल्याही प्रकारचा इंडियन जुगाड जर असेल ना, तर आपण एकदम खतरनाक असा करू शकतो. आणि देर आर ऑलवेज सम लास्ट पॉईंट्स that why don't you adopt this technology? There are some concerns regarding confidentiality, complexity. There are some cases of misdiagnosis, fraud and abuse, but the things are getting improved day by day, and you are going to get a cleaner environment. From where to learn? Adopt and teach your staff. तुमच्या स्टाफला पण तुम्ही ChatGPT शिकू शकता. A very versatile book. अच्युत गोडबोलेने लिहिलेलं आहे, Future Tech. But this book is very special for me because he has dedicated it to. Achyut always used to tell me that whenever he is my very good patient, his whole family is my patient, he brings all those VIPs to me. You know, it is very difficult from these actors and other people to manage. But he tells that whenever he meets me, whenever we share an idea, he has got some good concept to share with you. This was my editorial in our journal called as a JAPI. आपण सगळ्यांनी लहानपणी मण्याच्या माळेवर आपण सगळे 1, 2, 4 सगळे आपण केलेलं असं. सो दॅट इज कॉल्ड एज ॲबॅकस. सो इट वॉज अ डिजिटल टेक्नॉलॉजी इन क्लिनिकल मेडिसिन फ्रॉम कॅल्क्युलेटर्स टू ChatGPT. And this was our monogram, digital technology in clinical medicine. My niece, Dr. Tanvi, also she has contributed an article in this. If you are in medical education or if you are in a corporate hospital, तुमच्याकडे भरपूर पैसे आहेत. ते सगळे पैसे खर्च करा जरासं आणि हे NEGM AI नावाचं एक जर्नल लावा. NEJM AI. So one of the best journals, you can publish there and you will get lot of good win. आणि बऱ्याचशा आपल्या लोकांची डॉक्टरांची मुलं डॉक्टर होत नाहीत, सगळे इंजिनियर होतात, कॉम्प्युटर इंजिनियर होतात सगळे. दिस इज वन ऑफ द बेस्ट वे. त्यांचा एक दिवसाचा पगार म्हणजे आपल्या महिन्याची कमाई आहे. सो व्हॉट इज द अल्टिमेट एम? वी हॅव टू इन्क्रीज द AI रिसर्च, दिस कॉल्ड एज H इंडेक्स. भारताचा H इंडेक्स खूप कमी आहे. इफ US इज 413, वी आर ओनली 100. सो you can use technology, you can create more and more papers. Friends, AI and digital technology like three things, childhood things which we always enjoyed. Swimming, cycling and horse riding. तुमच्या नाकातोंडात पाणी गेलं पाहिजे, सायकलवरनं पडलं पाहिजे, गुडघे फुटले पाहिजेत आणि घोड्याने तुम्हाला फेकून दिलं पाहिजे, तरच तुम्ही या सगळ्या गोष्टी एन्जॉय करणार. सो प्लीज ट्राय टू अडॉप्ट, यूज अँड प्रॅक्टिस इट. इट इज समथिंग व्हेरी फॅन्टॅस्टिक. इट ऑल डिपेंड्स हाऊ यू लुक ॲट इट. What is your vision, how you look at it and how you go about it. There are certain drawbacks. What are the drawbacks? Number one, AI bias. ते AI कधी कधी येड्यासारखं पण वागतं. It will create a bias and it will make you to feel that he is right. There is something called as a black box concept. There are certain data which will not be in a position analysis, called as AI hallucinations. And where is the touch of the doctor? Where is the trust of the doctor? Where is the compassion of the doctor and what is the comfort of the doctor? Are we going to produce AI-enabled digital idiot doctors? No. We are not going to lose our touch. We are Indians. We will use our brain as well as we will use our AI. We are Indian known for adjusting all the jugaad. I have seen this Karkhana in Haryana, Indian Jugaad Karkhana. And we are member and proprietor, president of a company. आपल्या कंपनीचं नाव आहे ॲडजस्टमेंट कॉर्पोरेशन ऑफ इंडिया. मुंबईच्या लोकलमध्ये कुठेतरी प्रवास केला ना, ते 34 सीट कशी तुम्हाला ऑटोमॅटिकली मिळून जाते. सो वी आर व्हेरी क्लेवर. वी हॅव गॉट पेशन्स, बट वी शूड यूज ए राईट टूल इन आवर डे टू डे प्रॅक्टिस. नाव देर आर सर्टन प्लेसेस फ्रॉम वेअर यू कॅन लर्न दिस. दिस इज आवर organization called as the Doctors AI. Take a picture of this and we have got a virtual global summit. Get registered for that. सगळंच काही समजणार नाही असं नाही आहे, but whatever you will understand that will make a life change in your life. And if you want slides for any subject in the world, any subject in the world, you write to me on this email ID. This is my mobile number. Please join our Doctors AI community and please adopt, practice, preach digital technology and AI in your day-to-day practice. Be friendly, embrace it, don't be afraid of it. राईट ब्रदर्सपैकी समजा विलबुरनी तुम्हाला फोन केला, अरे माझ्याकडे एक नवीन मशीन आलं आहे, त्याच्या गाडीमध्ये बसशील का, आजा मेरे गाडी में बैठ जा, त्याच्यात तुम्ही बसणार नाही. वी विल ट्राय टू सीट इन अ एअरबस 380. सो मेक ए स्विच from your old to modern pursuit of thought. Friends, please be optimistic, informed, empowered, futuristic. Why Atal? Because this is Atal Setu in front of my home. And determined to build a bridge of knowledge of AI, technology and your fantastic clinical skills as a good doctor, what you already have. I cannot forget my batch of 1974, half of them are here. My family, my wife allows me 70 days in a year to travel. Dr. R.D. Lele, I was very fortunate to make an autobiography of him. Everybody knows Dr. Sortur, Dr. Sanpur and G.S. Kulkarni. We have just seen him today morning only. He is still fantastic and active. So friends, I end with appreciating visions of organizer Deepak, all your group, and I wish Kolhapur Medical Association all the best. Thank you very much.